Welcome back. Cancer incidence in Nigeria is increasing at an alarming rate, and the statistics are very dire. Cervical cancer kills one woman every hour in Nigeria. Breast cancer kills a woman every minute. Nigerian men are very prone to prostate cancer also, and 1 in every 10 cancer cases is prostate cancer. Though early detection has been proven to be the most effective cure against cancer, how often do we go for cancer screening? Joining us on the show today are 2 guests. We have Tewa Onasanya, who is the editor-in-chief for Exquisite Magazine, and Dr. Matilda Kerry. Welcome to the show, ladies.
Thank you.
It's so good to have you on the show. Now, we've talked on this show about breast cancer before, so we won't touch too much on breast cancer, but we're talking more about cervical cancer. Because a lot of women always say, oh, there's no cancer in my family, so yeah, I can never have cancer. So they don't bother going to check on it. Can you help us explain to us why we should go for cancer checkup?
Well, specifically for cervical cancer, yes. It's like you said, a woman every hour in Nigeria dies from cervical cancer. And it's quite a shame because cervical cancer is one of the few cancers that is preventable. Many cancers, we don't know the cause, they can't be prevented, but cervical cancer can be prevented because it's actually caused by a sexually transmitted virus called human papilloma virus. So once you know the cause, in medicine, you're able to halt the disease process and to treat. So if women present themselves for screening, then the doctor is able to identify if they have the HPV or if they have early cervical changes. And it's at that stage that we can halt the disease process, stop it from progressing to cancer. But if a woman is ignorant, she doesn't know that there's anything like cervical cancer, she doesn't know she's supposed to screen, then it gives the opportunity for that disease to progress to cancer. Because
in my case also, I had a case where in recent times, I went for myself and Tokwe actually went for cervical cancer screening, went for pap smear, and she was clean, perfect. They found cells growing actually around my cervix, and my doctor said, you know what, girl, this thing we need to fix it. We need to do a cryotherapy as soon as possible because if it grows, it becomes cancerous. So, and when I got home, my mother started praying, Jesus, God forbid, it's not in our family. I'm like, relax, woman, I'm not dying yet. You know, and I saw my husband, I was like, okay, no problem, my husband now followed me to the doctor to get a better understanding of what's going on. And when we understood, you know, I now did the procedure, but I didn't go for my second injection, HPV. I mean, I don't know what that was. I'm still in the process, but a lot of women just assume we'll pray it out of it.
Exactly, which is why awareness is key. I mean, somebody was saying to me yesterday, why are we still talking about cervical cancer? Why are we still talking about breast cancer or any other cancer? And I'm saying to them, the awareness or the education can't be limited, and we can't say, okay, it's enough, let's stop talking about it. We have to keep continuing to talk about it and keep telling people about it as well. Because in as much as people are talking about cervical cancer, a lot more people are dying every hour. And people are saying, okay, God forbid it would never happen to me, and they're not going for their screening. But it's not a case of it will never happen to me. Get yourself checked. Like Dr. Matilda said, cervical cancer is the only cancer that has a precancerous stage. And once it's caught early, you can be treated and you won't even have to have it get to the late stages before anything can be done about it.
Well, I have a question because you see, there's this, I spoke to a doctor about the fact that what if they discover HPV in someone? Does it mean the person has been promiscuous? Does it mean that the person can contact? No, but a lot of people out there are thinking about the same, they're wondering about the same thing. Now, in cases where you've already treated yourself for the HPV and all that, can you get reinfected by, they said it's a man that carries the virus. Can you be reinfected by the man?
Let me clear that up now. HPV is one of the commonest sexually transmitted viruses in the world. This means that if you have a room of 10 people, 8 out of those 10 people already have HPV. Now, it's not a question of being promiscuous. You could have been exposed to HPV at any stage, even if it was your first partner, maybe your husband, and he had HPV, you could be exposed to HPV. So let's move out of that, it's a disease of being promiscuous. Any sexually active person can be exposed to HPV. Now, talking about having the HPV and getting treated and if you can be reinfected, it is possible because there are 120 serotypes or types of HPV. Now, out of that 120, about 4 of them are sinister for causing cancer of the cervix. So let's say, for instance, you have HPV 16 and you were treated and the cryotherapy was done. You could still then go out, or probably your partner could bring in HPV 18 or HPV 11. So it's possible. So the key is not knowing you had HPV and you were treated, but having that culture of always going for your cervical screening continually, because it's so common.
I need to invite our callers so that they can join the show. You can call us on 070-8066-8014. You can tweet at us at YourViewTVC. We'd like to hear from you. You have any questions on cervical cancer, please call our doctor. Yes.
I have another question. Now, in cases where you've undergone the treatment for HPV, and like you said, you can't get reinfected
with that
same strand.
Already.
Now we know it's a sexually transmitted disease, and the only person that can give you is your husband. So can your husband get treated so that you know that you never ever get it again?
That's the thing about it. We are not actually treating for the virus.
Okay.
We are treating the manifestations that virus is having on your body.
So can men get treated?
The men are not getting treated because it's only usually in uncircumcised men that HPV can actually lead to cancer of the penis. But most of our men in Nigeria are circumcised, so it's very unlikely that they're going to come down with cancer of the penis from whatever HPV they're carrying. So we just leave them be. We don't screen them, we don't treat them, we don't vaccinate them.
Can any woman stay cancer-free? Can you just say, you know what, I'm cancer-free? How can you be cancer-free?
Cervical cancer, I mean, you can be cancer-free if you're not sexually active.
Okay.
For cervical cancer.
So once you're sexually active, you're
because the HPV virus is carried by men. And once you're sexually active, I mean, once you've had what's the word to use with the intercourse? Yes. Once you've had, some form of sexual intercourse, you are prone to it, which is why we're advising for screening. You said earlier on that, does it mean you're promiscuous or blah, blah, blah. The thing is, I have a story where a girl that was 10 years old was sexually molested by her uncle. And 11 years later, she's now 21 and just went for the screening just for the fun of it because everybody was talking about cervical screening at this school, and she found out that she has late stages of cervical cancer.
Oh, wow.
She's only ever had one partner, and that was her uncle.
11 years
Unbelievable. 11 years later. And this is somebody, and she's there thinking, and these are people that go around that, everybody goes around saying it will never happen to me, it will never happen to me. But just get checked. Yes. Just get yourself screened. Exactly. Just like you did. Yes. If you hadn't gone, God forbid.
Yeah, it could have been exactly. Let's invite our ladies because I know you guys are itching to ask questions. Let's start with Mikey.
Because you said 8 in 10 people and we are only 6.
It's very likely that a good number already have HPV. It's very common, like the common cold. It's so common.
Let me call Imole. Are you there?
Yes, good morning.
Yes, morning. Please go ahead.
I'm a first-time caller and I'm so happy to.
You're welcome.
Mrs. Ogidie, you say my husband's name. I'm so happy. I love you so very much.
Thank you.
Please, I want to ask the doctor, what are the signs of this cervical cancer? And what are the signs a lady will see for her to go to the hospital? And what are the things you will keep before you can say, maybe I'm having some signs of cervical cancer?
Thank you, Mole. Yes, thank you.
Great question. I get that question a lot. The thing is, you don't need to wait to see anything. Cervical cancer and the progression of the disease is silent until the late stage. So you're not going to notice anything at all when you have HPV, and if you're having changes in your cervix, there's not going to be any discharge, there's not going to be any smell, there's not going to be any sign at all. The only time you get a sign is when it has crossed into the cancer stage. Then in the cancer stage, when it's already late, the woman may start bleeding in between her periods. She may bleed when she meets with her husband. She may start having a very foul discharge. And then when it spreads to the other organs like the back pain, the brain disease, the kidneys, it could shut down all the organs. So no signs, no symptoms in the early stage.
The reason why we even went for our checkup was because we heard there was free screening. Can we have more free screening centers? Because the truth is that Nigerian women are very, very busy. It's hard for them to actually take out time, but we took our time from our own busy schedule.
Because we knew it was free.
We knew it was free. So shouldn't we have more free centers across Lagos State?
There are quite a number of people doing a lot of free stuff. I mean, Dr. Matilda does free stuff in January. We do free stuff in September. There are different people that are doing, even one of the doctors we've partnered with, Dr. in Surulere, also does free screening.
That's
where you guys went to. So a lot of people, there's quite a number of people, men and women, that are trying to fight the cancer case, so to speak, because we believe it's a form of cancer that people shouldn't be dying of. Yes. I mean, if you're screening yourself regularly, if they find the cells are precancerous, they will treat it. Yes. Same with breast cancer. I know you've talked about breast cancer before on the show, but same with breast cancer. If you just take out that few minutes every morning, or 7 days after your period, to check around your what's the polite word?
The breast is alright.
Around your breast, yes. To check around your breast every now and then. Yes. There won't be it won't get to a stage where the lump is now big and it's now cancer.
Abe, are you there? Good morning. Abe. Yes, go ahead, please. Good morning.
I'm going to be honest. I'm not really calling to contribute.
Okay.
I want you and Nigeria to help me. I'm being used for rituals.
Huh? You're being used for rituals?
Yeah.
Right now?
Yeah.
Where are you?
I see, it sounds weird.
Well, I can tell you that now.
Okay. Maybe we should call. Where's that Lagos State emergency number again? I think
767.
Call 767 and tell them that you are being used for rituals. We will also try to call. If you can give us an idea where you are.
Drop your number with the producer.
We can send the police over there.
Okay, thank you.
767 is the number to call, all right? All right.
Okay, interesting one.
My goodness.
Yeah.
It's frightening.
Whatever is happening, I pray God helps him to resolve what he's going through.
All right.
Back to what we're discussing.
Telephone companies can trace him. They can trace that call.
Okay. Yeah, I know.
The police, if they heard
trace
that
call. I think in Hollywood. What are you talking about, YK? Trace which call?
No, they can.
They can. Oh, really?
They can.
The number is registered.
Sorry. Well, I'll get the producer to call 767. All right. Back to the matter. Nama, what's up?
Yeah, I was gonna ask. You hear 3 years, 5 years. What exactly is the time duration that you have to do this screening? As in, how often should you be able to do?
It depends on what type of screening you've done. Like the pap smear, for instance, those are meant to last for 3 years.
Yes,
but
it's just a guide that we use, and we depending on the woman, she can choose whichever one fits into like her lifestyle and her schedule. Why we say 3 to 5 years is because that's specific for cervical, is because the virus takes about 5 to 30 years from the point of infection to the point of the cancer. So it's just like a window, a safe window. If you screen every 5 years, it's very unlikely that even if you were exposed, you're going to have the cancer. So it's just a guide. I advise women do it annually, so it becomes a habit.
Which is usually the visual aesthetic, using that type of screening.
Yes, visual aesthetic acid, or even pap smear, whatever screening. Try and do it annually, so it becomes a habit.
Okay, I have a
but
call.
The limit is 3 to 5 years.
Young, good morning. Are you there?
Morning.
Good morning, sir. Go ahead.
Yeah. Let me quickly about the first topic and how run through for the you talk about infertility and
Young, I can hardly hear you. Can you hear him?
Yeah. Infertility these days.
Yes.
Because of the food and tea and all these chemicals we eat.
Okay.
All those people are tend to the shop. So they now turn out. So we now get that impact. So because of that, we, talk about we need to do it.
All right. Thank you, Young. Thank you so much.
I was just hearing a little bit about the foods that we eat contributing to
infertility.
Infertility.
I heard him.
Oh,
Talk about your question, please.
Okay, well, the thing is, like you said, I want to just drop. I was told that we should do the screening annually because I know someone that discovered. By the time she discovered it, which was pretty late, it was within a year. That she died, and they were telling her that if she had come just a year before that they would have been able to treat it. So in some, the person is dead. She had never done anything like that before.
Exactly.
So we told her we should make it
in that cancer stage.
So I wanted something that we could drop with our audience in a way that every year
annually.
You should do annually both the breast and the cervical.
All right. Another final question, because we need to round up very soon. Shouldn't more organizations do awareness programs? And I know you're involved in some awareness programs where more women talk about these things, You know, instead of, because I always, one thing I accuse women of is we do too much of lifestyle and fashion and lipstick and weave on, and the real issues, we forget that. So shouldn't we do most? Because I know you guys are organizing a walk very soon.
Yes, we're organizing a walk very soon, and we're not the only ones. I have to say that, because yes, we're doing ours and then we're screening people free of charge, but there are also different organizations that are trying to do that as well, because like I said, it can't be enough. You just have to keep honing it into people and keep telling people. Even the funniest thing is, even the educated people and the literate people, because a lot of people, you know, travel here and there, they do all sorts of things, they're taking care of their outer part of the body, but they're not taking care of the inside. I
have Damola, last call. Good morning, Damola, are you there?
Hello, good morning.
Yes, go ahead, quickly, please.
Please, I have a question. I want to know what's called HPV.
Okay. Oh, all right. Okay. Thank you, Damola. Go ahead.
Yes, HPV is just a short form of human papilloma virus. It's one of the many viruses that can infect the human body and specific for causing cervical cancer.
Someone was like, there are mosques, Christiana or Labimpe, where can one get screening around Lagos? We'll retweet that. Somebody else says, there are over 120 comprehensive cancer center in India. Niger has only 120 registered private jets, but only one mobile cancer center. Then someone else says that, answer the question, HPV. What's the age limit of a male that can be infected with HPV?
Oh, there's no age limit. I mean, let's not dwell on that being infected. A woman can be infected, a man can be infected, a woman can give a man can give a woman. But it's when it's in the woman that it causes the problem most of the time. Okay. So there's no age limit. As long as you're sexually active, you're exposing yourself to HPV and you're at risk. So get screened.
The virus is actually harmless in men.
Yes.
Yes. If you're in the early stages of cervical cancer, is it treatable then?
Yes, it is, but you still need surgery to take out all the cancer cells, probably some radiotherapy also to make sure they haven't spread. It is treatable, but you're already a cancer victim or a cancer patient.
To close up the show right now. Ladies, thank you so much for coming on the show.
Thank you for having us.
Good luck on your walk, because I know there's an awareness going on the radios and all that. Yes. Please don't forget to watch the repeat broadcast of this show at 11 p.m. tonight. You can watch us on YouTube by searching for Your View Space TVC. And as we always said, domestic violence is illegal in Lagos State. There are laws against domestic violence. Please report any domestic violence case to the Ministry of Women Affairs in Alausa. God bless you and have a wonderful day. We'll see you tomorrow. Take care.